Hello, my name is Scott Wagner, and I'm one of the owners of Promotion Physical Therapy. I'd like to take you on a tour of the office to share the precautions we have in place to treat your patients safely. Before each office visit, we pre-screen your patient for any signs of infection. We will not see a patient in the office unless they are fever-free, cough-free, have not traveled to known COVID-19 hotspots in the last 2 weeks, are practicing social distancing, everyone in their social circle is healthy, and that your patient has no other reason to believe they have been exposed to COVID-19. Additionally, we ask your patient to wear a mask the entire time they are in our practice. If they come without a mask, we will provide them one. We require the same of our staff who come into contact with your patient. If there is any doubt of your patient's health or that of our staff, we will gladly reschedule your patient's appointment time to a safe time of their choosing, or convert their appointment to a telehealth visit. Let's take a tour of the office. We ask that patients wait in their cars until their appointment time. That way they can walk directly into the office and their treatment room. As you can see, we leave the front door propped open, so there is no need to touch door handles on the way into the practice. At the front door and throughout the office space, we have hand sanitizer that we encourage your patient to use. As you can see by our waiting room, we have removed chairs to maintain 6 feet of separation. We have also removed the common items from the waiting room, such as newspapers, magazines, and breath mints to prevent shared object contagion. Daniela and Bree, our administrative assistants, are working from home during this time to minimize people in the office. They can handle all phone calls, emails, scheduling, and payments remotely, facilitating a touchless administrative experience. We see patients in private treatment rooms. We sanitize the door handles, treatment table, chairs, and any other touch surfaces throughout the office, including our gym, between each patient appointment. We keep the treatment room door open for the entire session to prevent touching of the door handles, as well as to increase circulation. For hands-on treatment within the office, the therapist wears a clean patient gown that is changed between each patient visit to prevent contagion through clothing. This is our gym. We allow only 2 patients at a time in the gym, keeping them at least 6 feet apart. Any equipment, ultrasound, linens, and surfaces the patient comes into contact are sanitized between each use. I'm excited to share we have embraced telehealth for patients unable to come into the office. We use a platform that does not require your patient to download and install any software. They only need a smartphone, tablet, or web camera-enabled computer. This platform is HIPAA compliant. We've had great success treating patients virtually for rehabilitation exercises, post-surgical rehabilitation, general fitness to offset deconditioning associated with prolonged staying at home, as well as self-help massage and mobilization techniques using foam rollers and body rolling balls, among other assistive equipment. We also do home ergonomic assessment and modification of your patient's workstation for those patients working from home and experiencing pain. Education about orthopedic problems is also important, as well as strategies to keep your patient healthy and safe. We take the health and safety of your patient and our office staff very seriously. We greatly appreciate your trust in us and look forward to helping your patients in the future. Thank you in advance for the kind referrals.